Hannah Christensen-Levy, and today I will be showing you how to perform the golfer's elbow test in order to assess medial epicondylitis. What is medial epicondylitis? Medial epicondylitis is characterized by point tenderness at the medial epicondyle of the humerus. In 1883, Dr. Henry Morris discovered medial epicondylitis after seeing patients with medial epicondyle pain while pronating their arm. Dr. Henry Morris characterized this as lawn tennis elbow because of the repetitive pronation occurring during lawn tennis. It was later confirmed that activities with repetitive wrist extension, elbow extension, and forearm pronation cause medial epicondylitis. Medial epicondylitis is more commonly known as golfer's elbow or little leaguer's elbow because in golf and baseball there are several repetitions of wrist extension, elbow extension, and pronation leading to point tenderness during those activities. So I will show you how to perform the golfer's elbow test, and I will perform this on my patient Dana. As a patient, have the patient stand in anatomical position with their hands facing forward. And as the examiner, you will stand to the side of the affected arm. In terms of hand placement, the examiner will place their back hand on the back of the elbow to fixate the humerus in place, and they will use their fingers to palpate the medial epicondyle. In terms of patient action for the golfer's test, the patient actually does not do anything but remain relaxed because this is not an active range of motion assessment, but rather a passive range of motion assessment, which the examiner will carry out completely. There are three parts of the golfer's elbow test. The first is to pronate the forearm. The second part of this test is to extend the wrist fully, and I do this by taking the fingers and bending them backwards. The third part of this test includes pronating the wrist completely and at the same time fully extending the elbow. Thank you, Dana. A positive test for golfer's elbow will be pain during at least one of these three activities, but most likely all three of these activities. And the reason why there is pain during these tests or during the activities that cause medial epicondylitis is because the repetitive pronation and wrist extension leads to wear and tear on the tendon that the palmaris longus, flexor carpi radialis, flexor carpi ulnaris, and palmaris longus all originate from, gets inflamed, and without adequate rest, the tendon can continue to be strained even to the point of complete inflammation, and therefore any subsequent actions of wrist extension and pronation will cause pain. One possible modification to this test is if you have a tall patient where you are not able to adequately fixate the humerus, is to have them sit down in a chair so you can keep their humerus in place and are able to completely extend their elbow. The success and accuracy of this test is very high because of the fundamental difference between medial epicondylitis and lateral epicondylitis being the pain upon pronation for medial epicondylitis and pain upon supination for lateral epicondylitis. Thank you.